to the next session, which is an overview from the 4 countries, telling you how far we've got with strengthening the commitment. So Ben, I think you're up first. Ben Thomas is the Professional Advisor for Mental Health and Learning Disability Nursing at the Department of Health, an all-round good guy, which he is. He's going to be followed, I'm not going to introduce him in turn, he's going to be followed by Margaret Serrells, who is leads on learning disability nursing for me at Scottish Government, by Frances, who I can't see yet. Well, in that case, we're going to be followed by Jennifer French, who is the Nursing Officer for Mental Health and Learning Disability in Wales, and hopefully by that time, Frances Cannon from Northern Ireland will be with us. Okay, I'm going to hand over to you guys.
Oh, right. Well, hello everyone. How lovely to be here. Ros, thank you very much. I know we wouldn't have got as far as we've got without your sort of dedication and commitment as well. And I know you've been driving this agenda forward. So a personal thanks and a thanks from everyone for all the work that you do as well. I don't know what it is, but more and more when I speak at conferences, I'm only allowed 15 minutes. Now, I'm not sure. I'm not getting paranoid about it, but anyway, I'm going to whiz through where we are in England as far as strengthening the commitment is concerned. And I just want to start off with saying it's been an incredible year. It's been an incredible year for me personally, and an incredible year for strengthening the commitment, and I think the progress that we've made. So I just want to show you these photographs. A lot of you have been kind enough to sponsor a walk that we did for the Edith Cavell Trust. And Edith Cavell Trust, for those of you who don't know, is a trust that's set up specifically for nurses who for whatever reason, have fallen on hard times. And I have to say, through your generosity and just giving, we've raised now nearly £2,500 towards that. And all I had to do was walk up Snowdon, which was hard, really, at my age, but there we go. Right, okay. What am I pressing this towards? There we go. That would help, wouldn't it? Okay, quick quiz. Who are these 2 guys? Come on, shout out. You don't know? Okay. These 2 guys are going to be very important in the future. You need to get to know them and you need to influence them. I've already started. On your right is Sir Mike Richards, who is the new appointed National Director for the Inspector of Hospitals. And I've already met with him and said one of the things he must do on all his visits to hospital, and he intends to visit them all and inspect them, all the ones in England, by the end of the year, is ask questions and look out for how that general hospital treats people with learning disabilities, because it will say a lot about how they function, how effective they are, how safe they are, all those questions that he wants answered. This guy on the left is our new National Clinical Director for Learning Disabilities, and his name is Dominic Slowey. Yeah. I don't know Dominic. Does anybody know Dominic in the room? You know him, Mark. So what sort of guy is he?
On the occasions that I've met him, he seems to be quite dynamic and forward-thinking. So I think, again, as you say, if we make the connection, it's about persuasion.
Yeah. So Helen, I think we'll have him at Positive Choices.
Yeah. If you're on my list.
Yeah. Let's get into bed with him, as they say.
All right.
Okay. So I said it's been a busy year. This is some of the stuff that's come out. I don't want to dwell on it, but what I want to get across is, for every report that comes out, and we seem to be inundated with inquiries, the Prime Minister seems to want somebody to inspect something or look at something every week these days. So we've had the confidential inquiry, we've had the mid-staffs inquiry, and of course we had Winterbourne View, and all of these have got major implications for you as learning disability nurses. So, I don't want, that you probably read them as much as I have, but just to say that there is tremendous amount of work going on out there that has to be linked to strengthening the commitment. We can't see strengthening the commitment over here and all this other policy stuff going on over there. We have to integrate them. Okay, and of course we've had the 6 C's, compassion in practice, and I know a lot of you in the room have contributed to the vision and strategy for what the 6 C's means for learning disability nursing and how learning disability nurses can contribute to the 6 C's. It's on this website, so you can download it if you've not seen the latest edition. It's a live document. We're adding to it all the time. So if you feel you've got any ideas or you want to contribute to that, please do. What we're going to do is the Department of Health particularly is in charge or looking after Action Area 1, which is all about reducing inequalities and also promoting independence. And as you know, and you'll hear about later on, we've got the Health Equalities Framework, which is going to assist us in our task of reducing health inequalities. We want to make the document more user-friendly so that people, can use it and make good use of it. We're going to produce an easy-read version of it. And like all the other stuff I've said, we need to align it with other policy initiatives that are going on. And most important for me is that if you can keep sending me examples of good practice aligned to the 6 C's or aligned to the action areas, that would be really good. And then, of course, as time goes on, we will update the 6 action areas. So it's very much alive, and it's very much our vision and strategy for nursing in England. So be part of that, and be part of creating our future. What the next steps are we need to do a full report for the Francis Review, and also the Berwick Review, which looked at the safety in the NHS. And I have to say, it was quite a favourable report, even though there are areas where we could improve. Don Berwick, who's an expert from the States, who was Prime Minister brought over, was quite pleased, I think, generally, in what he saw in terms of the progress that we've made with regards to patient safety in the NHS. But that needs a response in terms of what we're going to do in future. And one of the problems that we do have, we've got a national reporting system. It's very difficult to pick up where patient safety incidents happen and they involve people with learning disabilities, because obviously we don't necessarily say that that person has got a learning disability. And I suppose the question that we need to ask is, should we be introducing some sort of flagging system, or, in terms of safety, or is that going to be stigmatizing? So have a think about that, because I'd be really interested in your views. We had the Cavendish Review report, and we need to respond to that. That looked at the role of healthcare assistants in the NHS. And I don't think there were any surprises in it really, apart from that we've got 1.3 million healthcare assistants working in the NHS, which is a staggering amount if you think that the whole registered nursing workforce is only 600,000 and something. So we've got nearly twice as many healthcare assistants as we've got nurses. And the recommendations in there is obviously that people need to be trained in order to do the job, because they did find healthcare assistants doing the job of registered nurses. So there's going to be some fundamental training, and people will receive a certificate. And also there's a big hoo-ha going on at the moment, because the Cavendish report basically said, look, healthcare assistants primarily assist nurses. What they do are nursing sort of, designated nursing roles, so therefore they should be called nursing assistants. So those still need responses, and of course they need linking, and of course we've got a recommendation in Strengthening the Commitment about bringing on the unregistered workforce. So I think that will fit in nicely with that. I've got to produce, as part of the Winterbourne View inquiry, there was a recommendation in it about writing a 1 year on report by the end of this year. So I'm busy writing that, and I have to say, it's great the amount of developments that have occurred since we published Strengthening the Commitment. And you're going to hear about a lot of those today, including stuff about leadership, including stuff about research, including stuff about outcome measures. So all really good stuff moving forward. And I really hope that that's how it feels to you, because that's how it seems to me. So I hope that's for real, out there in practice. And as part of Winterbourne as well, the other major recommendation that I'm involved in is we have to produce guidance by the end of the year around positive behaviour support and around physical restraint. And talk about a storm in a teacup. This is a very tricky bit of work that we're doing, and so I'm really pleased to say that Dave Atkinson is leading on it. And we've got Ian Stevenson on our steering committee representing students. But it is a tricky bit because, as you know, the Mind report has called for a ban on prone restraint, which the Minister has taken on board. And it's very difficult to persuade him that that is not the way to go. That is a red herring. And what we really need to do is improve particularly inpatient facilities in terms of staffing, expertise, and all those things that we know about. And I think, improving all of those things will lead to reduction of the use of restraint. But nevertheless, we've got to produce guidance by the end of the year. I think we're doing quite well with, because the other report, of course, was the 6 Lives report. And we're doing quite well. This year is going to be our 3rd conference on improving acute care for people with learning disabilities. And it's going to be held 15th of October in the John Radcliffe Hospital in Oxford. And as you know, Sir Jonathan Michael is actually the chair of that trust. So he's going to be at that conference. And then the other big piece of work is we're about ready to roll with a survey monkey asking all the directors of nursing, at the moment only in the NHS, but I'm hoping that is going to roll over into the independent sector, about a number of questions really about number of learning disability nurses that they employ, what their services are, all that sort of stuff. But important for us is what they've actually done to implement the recommendations in Strengthening the Commitment. So that piece of work is going to start at the end of this month, so I'm really pleased about that. Okay, and that's a lot for me. Was I in time? Hopefully? All right, thank you.
Yeah, I'll do the special questions then. So, this is Margaret Serrels from Scotland. Just to press it. There we go. Hello everybody, I'm Margaret Serrels, and I have to say I'm recently appointed to the post of Professional Nurse Advisor for Learning Disabilities in Scotland, and I'm absolutely delighted to have been offered a post, and I do see it as a great opportunity to contribute and to be part of shaping learning disability nursing, sorry my throat's away, nursing now and for the future. And I'm delighted to be able to share with you on behalf of Scotland all the good work that has taken place since the launch of Strengthening the Commitment. As you know, there's 17 recommendations came from the report, and the emerging themes were strengthening capacity, capability, quality, and the profession. And I know we were all asked to make a personal pledge to Strengthening the Commitment when registering for today's conference. So I think it is appropriate at this point, before I move on, to share with you some of the work Scotland has undertaken, that I share with you the commitment, the pledge made by the National Implementation Group for Scotland, and that people of Scotland who have a learning disability, their family members and their carers rightly expect to receive person-centred care, safe and effective everyday services, and when required, specialist healthcare services.
In order for us to meet this pledge, we need to continue to strengthen capacity and quality across all healthcare services to ensure this pledge is fulfilled, as well as strengthening learning disability nursing practice. Oops, sorry. So where are we now in Scotland? And I've kind of listed a couple of the things, and I'll just briefly talk about what we've done. Our National Implementation Group was established in November last year, and we're currently reviewing and updating our action plan following a number of scoping exercises around workforce data which has been gathered from our health boards, independent and voluntary sectors and our social care services. The data we are gathering from this scoping work is extremely important and will allow us to map out current and future service needs and influence the development of new specialist nursing roles at both local and national levels. This data will progress our work in addressing a number of recommendations from the report. The 26th of March saw the launch of the Scottish Action Delivery Plan, along with the pre-registration learning disability nursing framework and the career and development framework for learning disability nurses. We're working on the Health Equalities Framework, but I won't say too much about the Health Equalities Framework as Gwen is going to present in this work later in the day. But it is to acknowledge that 4 of our health boards in Scotland are implementing the outcome framework in partnership with the NHS Educational Scotland and strengthening the Commitment User and Service Group. We do have a co-production group, and this has been invaluable in supporting the development of this review and has provided meaningful contributions to specific elements of the review, and they led on the development of an easy-read version of Strengthening the Commitment, launching this work in London in April of this year. We now plan to further develop the role of the co-production group and aim to provide a more localised approach in order to support the work needed to fully implement the recommendations from the review at a local level. Both NHS Education Scotland framework for pre-registration learning disability nurses and the Career and Development Framework were launched alongside our Action Delivery Plan in March this year. Unfortunately, learning disability nurses has an ageing population, no more so than in Scotland. And I have to admit to contributing to this statistic. Therefore, succession planning is vital across all health boards. Over the last year, we have seen a significant increase in our student numbers, which have now increased to over 100 across Scotland. The national model for pre-registration nursing is progressing well, and both participating universities have now appointed the clinical academic posts. These posts will support the development, implementation and evaluation of a sustainable national model for pre-registration nursing in Scotland. They will also work closely with further education colleges, practice education facilitators, mentors and service users and carers to enhance the programme design and delivery to meet our workforce planning needs in both the short and the long term. A number of educational roles are being prepared by NHS Education Scotland that will enhance and further develop our current nursing workforce's skills, knowledge and competencies. A few examples include the development of skills in psychological awareness and learning disability, and an educational resource being developed for our healthcare support workers, which focuses on positive behaviour supports. These resources will be invaluable in ensuring all our nursing workforce are fit and continue to be fit for practice. Our most recent strategy, The Keys to Life, was launched on the 13th of June this year. This strategy was developed following a consultation process on our earlier national strategy, The Same as You. An evaluation team was established in 2010 to review and report on both the progress made across services as well as the challenges that remain within Scotland for the care of people with learning disabilities. Keys to Life made over 50 recommendations across all aspects of a person's life areas and has particular emphasis on health to ensure that all health professionals, not just specialist nurses, are working to meet the health needs of people with a learning disability. So what now? Our work to date throughout Scotland has laid down strong foundations from which to work from. We now need to strengthen these foundations by increasing our involvement with our frontline nurses, building wider supports into local implementation and linking into wider policies such as our Keys to Life and our quality strategy. Thank you.
So can I invite Jennifer up to the stage now? Jennifer, the professional advisor for mental health and learning disability at the Welsh Assembly.
No, just Welsh Government,
Welsh
there we are.
Government.
Yeah. Okay. Am I loaded up? Oh, does it? Okay. Good morning, everybody. God, it's hard to see everybody out from here, isn't it? It's like a bit of a blur. I'm delighted to be here this morning and be a part of this Paperclip challenge. As Ros said, a lot of work has gone into this. It's quite humbling, actually, and when you see the commitment and the level of enthusiasm people have got to sort of participate in this, it's really encouraging. So I've been in my post for just over 2 years. So I felt for Margaret just now coming up and doing this first presentation, because I can remember doing the same in Leeds at a stakeholders event. And this had already, Strength of the Commitment was already underway, and I'd sort of come in and had to catch up a little bit. And I'm very grateful to Ros and Ben and my other colleagues for being so supportive. When I came into post, our Chief Nursing Officer for Wales, Jean White, was very keen to tell me that this was a high priority for her. And in actual fact, she has to list 10 of her main priorities every year, and Strengthen the Commitment remains one of those 10 priorities. And when you consider, when we're looking across all fields of care, including cancer care and paediatric care, that modernising learning disability nursing and Strengthen the Commitment is up there at such a high profile, I think says a lot about the commitment from Welsh Government. And I think that's evident in the work that we're seeing across Wales. So Ben, I won't go over what Ben talked about in terms of the Winterbourne and the confidential inquiry, but I will say that in Wales, as well as sort of Strengthen the Commitment being pushed forward by the 4 UK CNOs, we also had a push from Welsh Government, and that was in response to an Ombudsman report for a death of a patient in a general hospital who had a learning disability. And the Minister at the time met with the person's family and committed to them that things would change and we would demonstrate that we would do things differently and make sure we did everything in our power that this didn't happen again. And I'm going to talk a little bit more about that as I go on with the presentation. Okay, so I'm going to talk a little bit about how we set it up in Wales and what we've been doing. Right. So, as we know, Ros Moore leads this for the CNOs in the UK. And then we have our UK steering group. And I need to change my Scotland lead, I'm sorry, Margaret. And then we break that down into each country. So we have our All Wales Ministerial Working Group, and then we have our local implementation groups. And the All Wales Ministerial Group is quite unique, really, because we've got lots of working groups looking at lots of different things in Wales, but the fact that the Minister has requested an annual update, which we're just about to submit to him, I think, again, demonstrates that there is this commitment. It's quite challenging, as it is in Scotland and I'm sure other parts of the country, in our rurality really in Wales and how we organise our services, and I've just sort of tried to break that up into our health boards. So we have 7 health boards, and so each of these sort of have their own implementation groups, except for Abertawe, Broma, Ganwg, who actually commission services for Cwmtaf and Cardiff and Vale. So it's quite complicated the way that it's organised. And of course, I think what's so positive about it is we're a small population in Wales of 3 million. So I know all the heads of LD nursing across Wales. I know most of the services across Wales. And so we can make sure that when we're looking at implementation groups, we're making them community focused rather than being too generalised about how we're delivering strengthening the commitment. I'm not going to go into the terms of reference because I don't think that we need to. I thought I'd taken it off, I'm sorry. Okay, so I'm just going to say quickly who our implementation group members are for the All Wales implementation group. It's been quite an interesting start really over the last year in that we've had to re-look at who's in our implementation group, because when we're looking at making sure that this group has power and that we're being listened to, sometimes it's not always helpful to have all learning disability nurses, because we're all singing from the same hymn sheet, and we have to make sure that the people who can influence are also a part of our group. So making sure that we've got input from directors of nursing, so it's at that level within organisations. Obviously, most importantly, that service users are fully involved in the whole process of it, because they are actually our strongest voice. And when I've struggled to get things done in Wales, it has been the service users with a direct actually lobbying of the Minister that has really pushed things, and I've had to go back to directors and nurses and say, the Minister has said, and that's come directly from service users' families. So just quickly, within our group, we're very fortunate to have Professor Ruth Northway, who's going to be speaking today as our chair, and is a very inspirational and fantastic leader for the group. We've got then representation from, as I say, all the health boards. More recently, we've brought in Public Health Wales. This was sort of done in a bit of an ad hoc way, really, and I'll talk a bit about that when we talk about the care bundles that we're producing, but we realised that we did need to have input from Public Health Wales, because the agenda isn't just about secondary care services, it's about sort of getting across the general population and making sure that we're understanding the needs of people with a learning disability at that level. And the other challenge I think we had was how did we engage the independent sector, because of course so many of our people who are having sort of inpatient care find themselves in the independent sector, and working as a government, it's how do we engage and make sure we've got all the independent sector represented rather than just one specific group. And again, in Wales, we're quite fortunate being small. We have the All Wales Independent Healthcare Association, so we managed to get a nomination from there. That's Keith Barry, who's recently joined the group, I think for the last meeting, and is going to represent Wales on the UK group. So it is growing, and I think we're getting more sort of valuable contributions now from areas which were lacking previously. A lot of the work over the first year really was trying to do a scoping, a bit like Margaret was saying has been happening in Scotland, trying to find out really where our learning disability nurses are, how many we've got, where we haven't got them and where do we need them, and really putting a push on, again going back to what Ros was saying, is the decrease in numbers we've seen in learning disability nurses over the past 10-20 years. And I'm very pleased to say that we have increased our numbers in Wales. I think Ruth knows exactly what the numbers are, our students. So our intake has gone up to 35, and that's gone up from about 21. So it's quite, I know it sounds small numbers, but it's quite significant in a small country like Wales, where we're sort of trying to increase numbers in all our nursing specialities. So when we looked at the pro forma, what we were looking at were learning disability nurses who have an identified area of specialism. So we wanted to know, have we got nurses working in hospital liaison schemes? Have we got epilepsy nurses? Is this consistent across Wales? And have we got, we know there's a massive deficit for learning disability nurses working at advanced practitioner level. We have one consultant nurse in Wales, who's here today, Chris Griffiths, so I'll be mentioning him again in a moment. But, again, that's a concern at the grades that learning disability nurses are working at, usually 5 and 6. I'm just being told I have to move, so I'm going to fly through this bit really quickly. The areas that we're very concerned about are preschool children and school-age children. It seems that the training has really focused much more on adult populations, and we're very keen that we should be age inclusive, particularly when we're looking at the issues surrounding people with a learning disability during transition periods, because we know this is one of the most problematic stages for families, for people with a learning disability, and how we manage that transition. So I'll whip through this just to say another area that we're very concerned about is the increase of people with a learning disability in our prison services at the moment. We've got very few forensic learning disability nurses, and again, Welsh Government have been working with learning disability services generally and have got now a pathway for people with a learning disability who go into our prison service, and again that's going to push forward the agenda to make sure we've got appropriate skills within our prison and forensic services. I can give more details about these other areas, but I just want to really go on just to go back to what Margaret was saying. We're very concerned about the age of our learning disability nurses across Wales, and particularly in education we're looking at as well in the universities, where again our future LD nurse lecturers are at a in a sensitive way maybe approaching retirement. And just an example, we just looked at Betsy Cadwalder University Hospital Board, and you can see from there the age range from 40 and 50 plus is quite significant, with far fewer between the ages of 18 and 29, so you really have to keep this obviously in mind. And I'm going to finish just on some very positive notes. So our All Wales Implementation Group, Ruth has done an immense amount of work on our progress report. We're taking that next Friday to our exec director nurse meeting, where we're both presenting that together. And it's a bit like what Ben was saying, it's making sure it's on our exec nurses agenda. It's no good putting it on our LD nurses agenda, it's already there. We've had a very successful campaign with MenCap, getting it right through our general hospitals. I think the most important thing that I want to just mention quickly is our 1,000 Lives Care Bundles, and this is such an incredible amount of work that Chris Griffiths, our consultant nurse, has been doing, and Abertawe Bro Maganwg Health Board, working with Public Health, working with the family of the gentleman that died that I told you about. This has been quite challenging, Chris, hasn't it? That the work has all been done, but it's how do we take that forward? And as I said, it's the Minister saying, I want this taken forward. We're very excited. We think we have a launch for it January. We're just doing the finalisation of it. So that means this will be rolled out across Wales. Every person with a learning disability then that goes into acute general care will be identified and have a care pathway that we monitor through our nursing matrix and our dashboards at an all Wales level. And I think that's a really significant thing that we've achieved in Wales. And finally, we've had 2 annual stakeholders events which have been really successful. We're going to hopefully tie our next one in January. This is all tied around your dates, Ros, just to let you know. And we're going to where we were focusing on independent sector and getting involvement, we're going to try, I think, to focus this more on our user involvement and family involvement. And so that's where we are in Wales. Thank you.
Called NIPEC, but she'll give you the background to where and how it's being taken forward in Northern Ireland. Thank you, Frances.
Yes. Blinded by the light. Good morning, everybody. My name is Frances Cannon, and I'm a Senior Professional Officer, as Rose says, with the Northern Ireland Practice Education Council. And I'm here representing our Chief Nursing Officer from the Department of Health in Northern Ireland. Basically, NIPEC was asked to take on the role of representing Northern Ireland in strengthening the commitment in the absence of a learning disability nursing officer at the department. Now, I would have to say, since I've been in post, and I'm in post just over a year, and I've been involved with this project for just over a year, We now have a nursing officer on a part-time basis, a learning disabilities nursing officer. So when Jen put up her chart and Maurice Devine was the lead and I was chair, Maurice Devine is acting in that role at the moment on a part-time basis, and he's going to be replaced hopefully on a full-time basis in the near future. Now, they normally say you should keep the best to last, but I feel this is not the best. However, I just want to share where we are in Northern Ireland around strengthening the commitment. For a variety of reasons, and I'm not going to go into those, we have had sort of a lack of maybe leadership and sort of direction around learning disabilities, nursing officers posts, and indeed our CNO post. But those things are about to settle down, and I think strengthening the commitment is going to be definitely taken forward much more rigorously into the future, in the near future. But just to say that NIPEC, in partnership with the department, last September actually run a task and finish group. And at that group was chaired by Frances Rice, an Executive Director of Nursing from the Southern Trust. And at that task and finish group, we invited a full range of stakeholders from learning disabilities and indeed other people who could influence learning disability services, including the voluntary organisations, to that task and finish group. And we developed an action plan in response to the recommendations from strengthening the commitment. I have to say there was a lot of energy at that task and finish group. There was a lot of people recognising this is a fantastic piece of work and we can actually reform and modernise learning disabilities nursing. Now, following on from that task and finish group, NIPEC, in conjunction with Maurice and the department, drafted an action plan, and that action plan has been submitted to the Chief Nursing Officer. Previous to, we've just had a new nursing officer appointed, so we've been in a bit of flux, but it has been submitted to the Chief Nursing Officer to be submitted to the Minister for Health, and he is actually going to send that out for a 3-month consultation. I was hoping today, Rose, that I would be able to say that it actually, I just checked yesterday to see had it gone out for consultation. It hasn't, but I hope within the next, well, certainly for the next event. If it's not, I won't be here. But it's ready to go out, and hopefully will be going very, very shortly. It is envisaged with the Northern Ireland Action Plan that we will develop, and it's one of the actions in the action plan is we will create a collaborative who will lead, and take the action plan forward. But I just wanted to finish with a very positive and on a positive note, because on the 6th of September, NIPEC actually hosted the last steering group strengthening the commitment meeting, which was chaired by Rose. And that meeting, and there's the steering group looking very well. And after that event, we had a Health Equalities Framework event, which Gwen and her colleagues are going to talk about later, where the 4 learning disabilities nurse consultants presented the HEF. Now, we invited our CNO, our new CNO in Northern Ireland. We invited learning disabilities nurses, managers, education providers, commissioners, executive directors of nursing from across Northern Ireland to hear firsthand from the learning disabilities nurse consultants about the HEF. And that was really a fantastic event. And the amount of interest, the amount of calls, the amount of emails that I've had as a result of that event has been fantastic. And I think it has reinvigorated everybody. Rose gave an overview of strengthening the commitment to these people, and it was a captive audience. And our CNO was there, and there is a fantastic commitment in Northern Ireland. We just need to get the next push from the Minister and get it through the consultation period. So, thank you.